What a fabulous buzz in the room. That's fantastic. Hope you've all had time to start some discussions. Already hearing a lot of enthusiasm, so wonderful. So thanks for your patience. We do now have Eve online and ready to go. So I'll just take this opportunity to introduce Eve while we just put her through. I've had the great pleasure of working with Eve over the last few years, and I'm so pleased that she agreed to stay up late to present to us this morning. Eve is an associate professor at Harvard Medical School and a research scientist at Massachusetts General Hospital. She's been studying TBI and interpartner violence for many years, and she's going to share some of her latest work that she's been working on with us here at AUT. What they said, lessons learned from qualitative interviews regarding brain injury following intimate partner violence. So apologies to start you off with a tough topic, but really great that we were able to connect in Eve with us this time in the morning. So over to you, Eve. Kia ora.
Hi, can you hear me okay?
No, we're just working on it. Keep talking. Can you say something?
Me now? Good? We're good? Okay. All right, excellent. So thank you so much. Thanks so much for having me, Alice. Alice, as I said, Alice has been an absolute pleasure to work with, and so I'm really happy to share information on the project. That it's still a work in progress. We're still writing it up. We've collected all the data, but we're just getting through the part about writing it up. So hopefully that will be done soon. And so Alice told you what I'm talking about already, and part of it really is, one of the points that I like to make is there's a complexity to the experiences of women who have experienced intimate partner violence when we're understanding brain injury, and a complexity that is there for women who are experiencing partner violence that's not there for people who sustain brain injuries in other contexts. And so I'm just going to, point out the two of the women who have led this research from my lab, Isha Sangvi and also Sarah Rose Cito, and also in collaboration with your very own from New Zealand, Doctors Alice Seedham and Jason Chua, without which this work could not be possible. So I don't have anything to disclose financially, but I will say that this content is not easy to hear and may be stressful for some. If it is, I encourage people to practice self-care. I'm available to speak to people afterwards. If they need anyone, just shoot me an email or whatever. I know we're in different sides of the world, but I'm always here. And so don't feel shy if you need to leave the room, or do whatever you need to do to take care of yourself. So with that said, I'm going to be talking about intimate partner violence, or IPV. And so what is intimate partner violence? Simply put, it's violence perpetrated by a current or former spouse, partner, significant other, boyfriend, or girlfriend. It does not necessarily need to occur within the home, and it can occur in a very brief relationship. Dating violence is inclusive included in intimate partner violence. And so sometimes people wonder, is that really violence? Well, yes, if you're in a romantic relationship with somebody and something happens, they hurt you physically, emotionally, sexually, that is intimate partner violence. Some really unfortunate facts about intimate partner violence, which I think are really critical, are the following. One, it's the leading cause of homicide for women globally. So I do my research in the US, but this is a global statistic as I try to keep some of my statistics here. So if the only thing you knew about somebody was that she was murdered, by the odds, your best bet would be that she was murdered by either her partner or an ex-partner. That to me is a really, really horrible statistic, as is this next statistic, that it's also the most common form of violence against women. So for people who are afraid to leave their homes or go outside because they're afraid some violent act may happen, they may be attacked by somebody, those are maybe some of the luckier people who are not experiencing intimate partner violence within their own homes, because that's the most likely cause of violence against women. And it's found across all socioeconomic boundaries. It doesn't matter who you are, what you do, what color you are, what race you are, how rich or how poor you are. It's found across all socioeconomic boundaries. There are women who are disproportionately affected by intimate partner violence and gender-based violence, but no one is immune to it. No particular group is immune to it. And so what are the numbers we're talking about? Well, globally, these numbers will change depending on what you're using to describe intimate partner violence and where exactly you are. But globally, the best estimates I think that we have are that 1 in 3 women experience some form of physical or sexual partner violence. And so when we think about this, I want us to really understand what that actually means. I think all of us know at least 9 women. We'll just take 9 as a number. You know, we could take 3 or 6 or 9, whatever. And so if we think of just a handful of women that we know, we could even take 3. And I want you to think, out of those 3 women, which one woman has experienced some type of physical or sexual partner violence? Or if it's 6 women, which 2? Or if it's 9 women that you think of, which 3? Because those are the odds. It's not gonna be the same exact for every single person, but those are the odds. And I can pretty much guarantee you that everyone knows somebody who's experienced some type of physical or sexual violence, even if you don't know it. It's stigmatizing. People don't necessarily want to admit to it, but it happens. And I want to make this very clear that these are just not the people over there. These are our daughters, these are our sisters, these are our colleagues, these are our partners and our friends. I want people to understand this for what it is, that this is all around us. And I want us to feel like this is our problem, no matter who you are. Because once we think it's our problem, then we're more invested in making a difference and making a change. So, unfortunately, intimate partner violence, 80 to 90% of injuries to women are to the head or neck. I've had women tell me about being stomped on the head with work boots, hit in the head with fists, smashed in the head with hammers, and whacked on the head with baseball bats. I wish I could say that these were the worst case scenarios, that didn't happen often, that I'm sort of cherry picking people who told me, things that, I thought would be provocative. I'm not trying to be provocative. I'm just telling you what the truth is. Unfortunately, these are the sad facts. And I could say even worse things if I wanted to, but I don't need to. But so if we think about this, obviously, women are sustaining injuries to the head and neck. And so these can result in brain injuries. So we can have traumatic brain injuries, or TBIs, from blunt force trauma to the head. I think a lot of people understand that and say, oh yeah, if you get hit in the head, that would make some sense. You might sustain a brain injury. But what also women who are experiencing partner violence need to be worried about is strangulation, which is a form of asphyxia from external pressure placed upon the neck. So when we think of sort of these groups of individuals who have sustained brain injuries, I think a lot of people think of athletes. Of course, why wouldn't we think of athletes? Because athletes are so well known in the brain injury field. We have all these protocols for protecting athletes from brain injuries, and we see those brain injuries happen on the field. And we know if you get knocked in the head, you're going to have a risk of a brain injury or a concussion or whatever you want to call it. Women who are experiencing partner violence have both strangulation and that blunt force trauma. Now, sure, we can argue about MMA folks or some subgroup of athletes who also basically choke themselves, have themselves choked out, whatever. But let's just say, for the most part, what people are studying in terms of what people are concerned about. So women who are experiencing partner violence are in, unfortunately, kind of unique situation where they're experiencing the worst of the worst, sort of ×2, with respect to blunt force trauma and asphyxia from external pressure placed upon the neck. So what do we know about this? How many women are actually sustaining brain injuries from partner violence? Unfortunately, my data, a study that I did, showed that a majority of women who have sustained partner violence sustain IPV-related brain injuries. If we just look at this schematic, if you look at the 42 over there, the 42M, I went a little too fast there. That represents the number of women by that 1 in 3 statistics in the United States alone who have experienced some type of physical or sexual partner violence. 42 million women. Now, in a study that I did with 99 women, what I found was that 74% of those women sustained at least one brain injury from their partner. That would translate into over 31 million women in the United States alone who have sustained brain injuries from their partners. What's even more disturbing is that 51% of those women sustained repetitive brain injuries from their partners, translating into over 21 million, of women in the United States alone. Now we could say, well, maybe these numbers are not accurate. Of course, I don't necessarily expect these numbers to be accurate. These are convenient samples, etc. But if we go a step further, which is what we did, we looked across 18 articles where there was some type of estimate provided. It may have been a loose estimate, may have been, really based on a small sample or whatever. But the bottom line was, if we looked at how people may have looked at brain injuries in women who experienced partner violence, we discovered there was a wide range. On the high end, 100%. Some samples just said every woman they interviewed sustained a brain injury from their partner. And in some, the lowest one was about 27%. So it isn't just this one or two studies. This is out there. This is really happening. And this is extremely underappreciated. And so the other thing that I wanted to do was just to spend 1 minute. I don't have time to tell you all that I know about this, but I want to explain that it's not just that they're happening, these are associated with negative outcomes. IPV-related brain injuries are associated with poor cognitive and psychological outcomes. Higher brain injury scores were associated with poor performance on tests of memory and learning and cognitive flexibility, as well as higher ratings of general distress, depression, worry, anxiety, post-traumatic stress. So women are really just getting a lot of negative outcomes associated with having brain injuries and more brain injuries, which may be in the form of either blunt force trauma or strangulation-related alterations in consciousness. And I'm not going to go into the details here, but there could be some concern that what I'm seeing here is associated with the abuse severity itself, or psychopathology, or substance abuse. We use those variables as covariates in the analysis, and that is not what we're seeing here. We are seeing links between the brain injuries and these negative outcomes. So what we wanted to do was we're at a point in this field, finally, the intersection of IPV and brain injuries has become a bit of a field after about 25 years of trying to make it such. And what we wanted to do was hear from the women themselves, like what they thought about brain injuries. Did they think about brain injuries? Did they seek help for their brain injuries? What were barriers to seeking help? What was this experience like for them in a way? And so we did a qualitative study. And in this qualitative study, we interviewed 16 female identifying adults who were previous participants in another study. We had 1 hour virtual interviews conducted with each participant. It was about an hour. It may have varied a little bit depending on who the participant was. And interview transcripts were analyzed for shared themes using an interpretive descriptive approach. We didn't have a predetermined framework specifically for what we were doing. So that's just the bare basics, bare bones of the analysis, because I don't have a lot of time here. And what we found, I thought was just really striking. Some of what we found is sort of consistent with what we might have guessed or what we heard anecdotally, and some of it was actually a little, not surprising, but eye-opening. So first, women's experiences of head and neck injury. Basically, one of the things we found was that there might be difficulty determining if behavior was even considered IPV, or sort of, and if that was kind of, was it IPV, was it a brain injury, etc., because of the complexity here. And so here's just one example. Woman said, so the complicated thing about my history is that it started out as a consensual, like, BDSM relationship that got really bad really quickly. So that's part of why it was so hard to process everything. For him, I think it was within the context of a sex act, and he was very, very rough with me. Things were very painful, and it felt like I've been in a car wreck. So here we are. I think usually if someone sustains a brain injury or is strangled or something like that, you kind of know that this is not necessarily good, that this is a problem, that this shouldn't be acceptable. But here we are at this intersection of is this part of what I agree to or not? And so it can be very complex and complicated. And if you don't even think anything bad has happened, you're certainly not going to try to seek help or maybe even try to stop it. Really importantly, brain health is not necessarily a priority at the time of the injury in some of these instances, as illustrated by this woman's quote. She says, no, it didn't occur to me. I really was more concerned with getting the glass cleaned up off the floor because, I had a toddler who was going to be crawling around. I called his mom for help and said, you know, we just had a fight, and I didn't tell her he strangled me, but I just said, you know, I need help getting this cleaned up. I never thought I should have gotten help. I had no idea that he crushed everything in my neck, and then it would plague me for the rest of my life and be a huge part of my disability. So in these situations, it's not just like, okay, there's a clear accident, there's something clearly bad that happened, and so we're going to get necessary interventions or treatment for this. If you're worried about your child getting injured because of the glass, or maybe you're worried about your child getting injured and maybe DCFS or some other child agency is going to come in and say you're an unfit parent because your child was injured, you don't even think about what might be going on with yourself, which is in stark contrast to most other individuals who might be sustaining a brain injury. So understandings of traumatic brain injury. Basically, you found out that it was mixed. And I can only give a couple here in the interest of time. For example, one woman said, I didn't know if I was dazed because I hit my head or because I was shocked at what happened, because that was the first time I'd ever got hit so. And yeah, that's exactly true. Women dissociate sometimes from abuse. And sometimes there's no hit to the head at all, but they don't remember things, they feel disoriented. And it's because it's extremely psychologically traumatizing or distressing. And so if you're also hit in the head, you may be thinking, well, I don't know, maybe it's just the abuse. Maybe it's just I'm stressed out. Another woman is, I just never really thought much into it. I have people who I know that I know they have TBI that have been in car accidents and things like that, and their speech is affected. Other things are affected because of that. And so no, I didn't think anything of it. So it's sort of like some people think of a traumatic brain injury as unless you can't speak or unless you can't walk or unless there's some clear disability or inability to function in a certain way, then it may not be a TBI. So if you're just not thinking straight, you can't do what you used to do, but it's not really obvious, it may go completely unrecognized. Also, knowledge is empowering and grows over time, and I think this is really important to know. One woman said, I actually found out some of that information from doing my own research and self-help, like trying to heal through all of this. And the domestic violence research I follow on Facebook frequently talks about traumatic brain injuries and specifically the correlation between statistics of, if you've been strangled, the likelihood that the violence is going to escalate to murder. That's not something anybody ever talked about, or I probably would have figured out how to get out even faster than I ultimately did. So it's never necessarily easy to get out of these relationships. Sometimes it's incredibly difficult or impossible. Remember, women are murdered by their partners quite frequently, and when they leave is the highest odds of being murdered are when you're leaving or after you've left. So this is a really important point. Barriers to deciding to seek healthcare, just deciding to seek healthcare. These are some of the things women have to deal with. Shame, guilt, fear, injury severity, partner control. With respect to shame, fear of repercussions, cultural shame, self-blame, those are the types of things that prevent women from even trying to get medical attention. And then, will anyone believe me if my injury is not severe enough? If I just walk in saying I haven't been able to think straight for the past 3 days, is anyone going to even believe that anything happened to me? And then perpetrators will physically prevent women from seeking help. They may hide keys, they may threaten them if they leave. During COVID, one woman said, this was not from our study, but anecdotally, the woman was basically told, if you leave, I'm not going to let you back in because you might give our kids COVID or me COVID. Anyway, if you get through all those things and you're a woman, then maybe you can actually decide to seek healthcare. And then if you do, then we get to this position where do we want to actually seek healthcare? Fear, embarrassment, and uncertainty contribute to the complexity here. And this is one of the saddest quotes that I've ever, unfortunately had to read. I was very scared because a lot of times he was telling me that I would be admitted to a hospital. And sometimes he would even show me pictures of these rooms that had foam on the wall. I was scared that because I couldn't explain what was happening to me. So how could I explain to someone what's happening to me And then they're gonna think I'm crazy. He would tell me, let's go to the hospital. I might never see you again, and you're gonna see your family again. And it's just, I was just all alone here and an immigrant. I thought that they would they would restrain me or like strap me to a chair or something. I thought I was crazy. So this is not something that someone who sustained a brain injury or wants to seek medical care usually has to deal with, unless you're in a situation like this. Deciding to disclose to healthcare professionals is a whole nother level. Once you decide that you're going to get medical attention, then are you actually going to disclose what happens? And unfortunately, lack of trauma-informed questioning in healthcare settings is very discouraging. This one woman reports, I remember certain times when, I was asked if I'm safe at home, and my home was, like my abuser was there. Also, my children were there. So it was a very difficult way to explain that, if I'm safe at home. But that's the only question I remember being asked. Like I wish someone else would have asked me some other questions. And, likewise, what she said in other sections was in a different context, not in front of her children or the abuser. And also perceptions of own behavior are sometimes seen as unacceptable and also make disclosing difficult. As in this case. No, this was a secret relationship for my parents at the time. Also, they were pretty religious, and I just wasn't that devout. So I didn't seek help afterwards, and there was a lot of gaslighting. So, towards the end, I pretty much believed it was my fault. So again, here, when there's privacy, when there's silence, when there's lack of knowledge, it's very easy for people to think that what has happened is maybe acceptable or their own fault, and it may make it very difficult for women to then have the strength to go and seek the care that they actually need. So ultimately, the goal of this is we needed to try to use the stories of these women and the data that we collected here to improve the healthcare system. And we're not finished here with these conclusions yet, but just some really obvious ones that came out is we really do need brain injury screenings in healthcare settings. Women should be asked, we should be doing this in a very safe, scripted manner where we know that women are going to be heard, and it's not going to be something that's done in front of people or in front of children. That falls right into this idea of trauma-informed training for providers. We shouldn't be asking women about things like how you feel safe if your partner is in the room. And you shouldn't be saying things like, well, what did you do to deserve this? And you shouldn't be saying things like, well, wow, you're back here again. Very, very awful things for our healthcare providers to ever say to anybody who shows up and, for treatment. And finally, increase community awareness, resources, and services. I think awareness is way, way up there. We need the awareness. Once we get the awareness, maybe we can get the resources and services. I cannot see any reason why all shelters do not have a rehab component to their training services. But I don't know any that do. Well, there's maybe one or two. And so with that, I'm going to close because I think I'm at time. IBP-related brain injuries are very common and extremely, extremely complex. I do think it's our job to listen, recognize, and intervene, and there's my email for anybody who wants to follow up. Thank you so much for having me and listening today.
Thank you so much, Eve, for sharing that with us. Just mindful of time, but I'm mindful Eve isn't here with us in the room for you to talk to afterwards, so I would like to make time if anyone's got a question or a comment for Eve that I'll translate back. Please.
ACC to see Eve's video?
Eve, are you happy for me to share your video?
No, I mean the ACC dealing with a lot of. I just feel like a lot of people at ACC who are dealing with women who actually make those sensitive claims, they need to see that and hear that and understand it.
I agree with you. We haven't really spoken much with ACC about this field yet because we're hoping to generate the discussions through the findings of this research. So Eve, the question is whether I can share this video with ACC so that they can be much more mindful of this as an area, which I think is a great idea. Would you be happy for me to do that?
I mean, I don't know what ACC is, but I think I'll say absolutely.
Thank you. So ACC is our accident compensation provider who provides support for people with brain injury.
Absolutely, absolutely. Like I said, raising awareness is critical, and so everyone needs to know.
Fantastic, thank you. And one more, I saw a hand over here.
I was just wondering if there's any sort of stats in violence against men?
So the question is, are there any stats on violence against men?
And, that's a great question. There really aren't that many. I mean, there are some statistics on prevalence of intimate partner violence. And, intimate partner violence definitely happens to men, but what happens to men is pretty different than what happens to women overall. On average, women tend to be smaller than men, and on average, women are more likely to be injured by men. With respect to understanding brain injuries, I think it is something that we should try to understand, because I suspect some have sustained brain injuries. But considering that most research has been done on men overall in general, and it would be really hard to get a study going trying to get men into the study. I'm starting with women, and hopefully we will get to understand men as well. But right now, we have zero statistics on the intersection of TBI and IPV in men, I will say that. I don't think it shouldn't be done, but I just think that the more pressing issue would be women for the reasons that I just stated.
Thanks, Eve. Appreciate that. And thanks again for joining us this evening. And really